I have no doubt that this will be a budget buster, and with that, I'd like to yield 1 minute to the distinguished member of the Budget Committee, a gentleman from California, Mr. McClintock.
The gentleman from California is recognized for 1 minute.
I thank the gentleman for yielding. Chairman Ryan noted the false claims upon which Obamacare was sold to the Congress, and I think they bear elaboration now that we know what's actually in it. It didn't bend the cost curve down. The Medicare actuary admitted to the House Budget Committee last year that it will add at least $300 billion more upon our health care costs. It hasn't been good for the economy. The gentleman from Maryland asks for the Congressional Budget Office's opinion. They admitted to the House Budget Committee last year that, in fact, Obamacare would cost our economy a net loss of 800,000 jobs. They also told us if you like your plan, you can keep it. Well, the McKinsey survey of employers reports that nearly 1/3 expect to drop their employees' health plans as a result of this law, like them or not. Seems to me 3 strikes and you're out. We need a system that puts patients back in charge, that provides tax reforms to put health care back within the reach of every American family, and restoring to them the freedom to make their own health care decisions without the interference of government bureaucrats. This bill is a necessary first step to get us there. I yield back.
The gentleman from California yields back. The gentleman from Maryland is recognized.
Thank you, Mr. Speaker. Just to respond to my friend, the chairman of the Budget Committee, with respect to the CBO estimate, if it was true that over the 10-year period you had the tax revenue loaded in a way that sort of would deceive, so-called deceive the impact of the deficit, it would stand to reason it would get worse over the second 10 years. In fact, the deficit savings, in other words, the reduction to the deficit, is greater over the second 10 years, according to the Congressional Budget Office, than the deficit reduction over the first 10 years. And if you repeal the bill, as the Republicans are proposing to do today, you will not only add to the deficit in the first 10 years, but you'll add even more to the deficit over the 20-year period. I now yield 1.5 minutes to the gentlelady from Florida, a member of the Budget Committee, Ms. Wasserman Schultz.
The gentlelady from Florida is recognized for 1.5 minutes.
Thank you. Thank you, Mr. Speaker. I rise today because it's time to put an end to the pointless partisan games. The Affordable Care Act has now been passed by a duly elected Congress, signed by the President, and upheld as constitutional, despite the chagrin of our colleagues on the other side of the aisle and their best effort, upheld as constitutional by the United States Supreme Court. And more importantly, Americans, and particularly South Floridians, are already benefiting from this law. Thanks to the closing of the coverage gap, the donut hole, seniors in my district can now afford their prescription drugs, instead of having to choose which ones they have to leave behind at the pharmacy because they can't afford to take them all home when they fall in the donut hole. And young adults have the security of staying on their parents' plan until the age of 26. As a cancer survivor and a mother, this law is important to me because through it, the nearly 4 million Floridians who don't currently have health insurance will be able to get the coverage that they need. Mr. Speaker, this is our 31st vote to repeal all or part of the Affordable Care Act. It is time to stop the tantrums, grow up, and work together on Americans' #1 priority, creating jobs and getting this economy turned around. I look forward to working with my colleagues and any colleague on either side of the aisle to focus on job creation, getting this economy turned around, and focusing on our Americans' #1 priority, which certainly is not fruitlessly engaging in partisan bickering. Thank you. I yield back the balance of my time.
The gentlelady from Florida yields back. The chairman from Wisconsin is recognized.
Mr. Speaker, I'd like to yield 1 minute to the gentleman from Oklahoma, a member of the Budget Committee, Mr. Langford.
The gentleman from Oklahoma is recognized for 1 minute.
Thank you, Mr. Speaker. Americans know more about this law now. Now that it's been sitting around for 2 years, we've had more time to be able to process it. 2 years ago, the cost was estimated by CBO at $800 billion. Now it's estimated at $1.8 trillion. Americans were told that if you like your insurance, you can keep it. But now the administration estimates that up to 80% of the small employer plans will lose their grandfathered status, and up to 64% of large employer plans will lose their grandfathered status and will have to be changed, of course, at the end of 2013 after the election. They were told you could keep your doctor, but now we know that physician-owned hospitals, their practice and their days are numbered, since physician-owned hospitals are pushed to protect the bigger hospitals in this. We told there were no new taxes on it. This wasn't a tax bill. Now we know there are 20-plus different taxes on it. The supposed deficit reduction goes down in the days to come because there are so many new taxes that are built into this. Let me give you a couple of my favorites that are built into this. Removing the deduction for people with high medical bills. Yes, there's a deduction if you have high medical bills. They move that cap up. So if you have high medical bills, you will pay more in taxes under this. How about the flexible spending account cap change? So if you have a special needs child that you currently have special needs and have that, your taxes will go up. With that, I yield back.
Gentleman yields back. Gentleman from Maryland is recognized.
Thank you, Mr. Speaker. I now yield 1 minute to the gentlelady from Alabama, Ms. Sewell.
Gentlelady from Alabama is recognized for 1 minute.
Mr. Speaker, with only 14 legislative days left before Congress lets out for the summer recess, I want to register my disappointment that my Republican colleagues are now willing to spend yet another hour, 5 hours, for the 31st time in trying to repeal the Affordable Care Act. Instead of using this valuable time to put our country back on track by investing in job creation and stimulating economic growth, House Republicans have opted to divisive politics and partisan politics. I believe enough is enough. The American people deserve better, and frankly, my constituents expect better. Not only has the Affordable Care Act been passed in both houses of Congress and signed by the President, it was upheld by the highest court in the land merely 2 weeks ago. By now, we should be moving forward and acknowledging the benefits of the Affordable Care Act, which the House Republican leadership cannot seem to grasp. In my district alone, the reality is that 77,000 seniors receive affordable prescription drugs now. The reality is that 36,000 children in my district can no longer be denied coverage for pre-existing conditions. We must get back to the work of the people. I am reminded, once again, that we've had 14 days left till recess. Please, let's get back to the business of the House, which is getting people back to work. Thank you.
Gentleman from Wisconsin is recognized.
I'd like to yield 1 minute to the Vice Chair of the Budget Committee, the gentleman from New Jersey, Mr. Garrett.
Gentleman from New Jersey is recognized for 1 minute.
So one accepts all the contortions and flimsy reasoning of Justice Roberts' opinion on the constitutionality of this law. It brings to light one important consequence. The President of the United States has not been straight with the American public. See, the court justified the individual mandate by calling it a tax. Now, I side with the dissent in this, but the Supreme Court has spoken. And the Supreme Court has now put the President in a tight spot. See, the President of the United States has said repeatedly that no family making less than $250,000 will see any tax increase. Not your payroll tax, not your income tax, not capital gains, not any tax. You know, even the OMB director from this administration came to us and said there are no tax increases in this. Again and again the President has said this to us. But Justice Roberts said, yes it is, it's a tax. Look, Mr. President, it's time that you be straight with the American public. We must repeal Obamacare. It is a broken promise this country can't afford. If we don't, it will be the final nail in the coffin of a dynamic free enterprise system. And as Speaker Boehner once said, we must pull it out by its roots, and if we do, then we can plant the seed of real health reform in this country. And with that, I yield back.
Gentleman yields back. Gentleman from Maryland is recognized.
Thank you, Mr. Speaker. I think this whole conversation about a tax or a penalty has gotten us a little bit into the silly season. If you go to the state of Massachusetts website and you look at the Romney Care plan, what they say is that if you're able to afford insurance but decide not to get it, you will pay a penalty collected through the tax system. A penalty collected through the tax system. Obamacare is modeled on Romneycare. And as Governor Romney understood at one time, if you say to people who can afford health insurance, it's okay that you don't get it. Just show up at the hospital and everybody else will pay your bill through their higher premiums, or taxpayers who have to pay uncompensated care to hospitals. That's free riding on the system. That's freeloading on the system. That's saying to every other person, every other taxpayer, that other people should be responsible for paying for the health care bill of the person who chooses not to get health care coverage. And yes, if you can afford health care coverage but you decide to free ride on other people, then there's a little penalty under this bill, just as there is under Governor Romney's proposal, a proposal, by the way, that was once widely supported by our Republican colleagues when they talked about the importance of personal responsibility and the importance of making sure that people who are going to use the health care system took some responsibility for paying for their health care system. I now yield a minute to the gentlelady from Ohio, Ms. Kaptur.
Gentlelady from Ohio is recognized for 1 minute.
I'd like to thank Ranking Member Van Hollen. And, Mr. Speaker, I rise again to oppose the Republicans' destructive attempts to repeal the health care reform law, the 31st such attempt in this Congress. In Ohio already, the law has been making a difference for hundreds of thousands of people, middle-class families. For over 2 years, nearly 100,000 young adults in Ohio have been able to remain on their parents' health insurance plan. In the first 5 months of this year, over 700 seniors just in my hometown of Toledo, Ohio, have collectively saved over $500,000 on prescription drug costs. Last year, 1.2 million Medicare beneficiaries in Ohio received free preventive care from their doctor, like mammograms and colonoscopies. Insurance companies are now paying out over $11 million in rebates to Ohio families because the insurance companies did not spend enough on paying for health care. And over 4 million Ohioans, 4 million, including 1.5 million women and 1.1 million children, have seen their insurance companies drop the lifetime and annual limits on care they had previously opposed. The Republicans here in the House of Representatives are voting to take away all these benefits. And what is the Republican plan to replace it? Nothing. The Republican plan to replace it is nothing. Mr. Ranking Member, I thank you so much for yielding the time, and I yield back any remaining time.
Gentlelady yields back. Chairman from Wisconsin is recognized.
I yield a minute and a half to the gentleman from Rakita, a member of the Budget Committee from Indiana.
Gentleman from Indiana is recognized for 1 minute.
I thank the chairman. I thank the chairman. I thank the speaker. You know, my 18 months here, one thing has been clear, in that, just like so many bills, this bill isn't just about the underlying subject. What this bill is about is controlling the individual. What this bill is about is government oversight, government control, government decision-making by bureaucrats hundreds of miles away from us over something that should be between us and our doctor. I do agree with the gentlewoman from Ohio. This bill, this law, has already made a difference. The facts are clear. Obamacare will add trillions of dollars in new taxes, increase our $16 trillion national debt by hundreds of billions of dollars, cause millions of Americans to lose their health insurance, destroy jobs, increase health premiums, impose new costs on states, and penalize American innovation. It's making a difference. In Indiana, I also agree with the gentleman from Ohio. In Indiana, it shows just how harmful this law will be to the Hoosiers I represent. For people purchasing insurance in Indiana's individual market, premiums are expected to increase 75 to 95% from 2014 to 2020. Since passage of Obamacare, my state has seen 5 insurance carriers withdraw from the individual market, resulting in less choice and less competition for Indiana consumers. Indiana estimates that implementing and operating a federally mandated exchange would cost between $10.4 and $18.3 million annually. Yes, Mr. Speaker, this law is making a difference, a bad difference. As the House votes again to repeal President Obama's unpopular health care law, the American people must continue to make their voices heard. End of story. Personal health care decisions should be made between individuals and their doctors. Obamacare passed more than 2 years ago. In the infamous words of the House leadership on the other side of the aisle at that time, we have now had a chance to see what's in it, and the fact remains, we do not like it. And I yield back.
Gentleman yields back. Gentleman from Maryland is recognized.
I reserve the balance of my time.
Gentleman from Maryland reserves balance of his time. Chairman from Wisconsin is recognized.
I yield at this time 1 minute to the gentleman from Indiana, a member of the Budget Committee, Mr. Young.
Gentleman from Indiana is recognized for 1 minute.
Thank you, Mr. Speaker. My friends on the other side of the aisle keep saying we should focus on jobs. So let's look at how Obamacare has impacted jobs and the economy. A few numbers. 48% of business owners cite the potential cost of health care coverage under Obamacare as a reason why they're not hiring additional workers. 74% of small businesses said the law will make it harder to hire new employees. States like my home state of Indiana would be hit particularly hard. Among the 21 new taxes found in Obamacare, there is a 2.3% excise tax on the profits from medical device companies. Now, Indiana and southern Indiana in particular is home to dozens of these businesses. It employs over 20,000 Hoosier jobs in this medical device sector. Now, because of the negative effect on our economy, we must start over and get health care reform done the right way, in the light of day, with bipartisan support and with due deliberation. I hope we can do that. That's why I'm proud to co-sponsor this first step, the Repeal Obamacare Act. I urge all of my colleagues on both sides of the aisle to support it too, and I yield back.
The gentleman from Indiana yields back. The gentleman from Maryland.
I reserve.
Gentleman reserves.
I'd like to
From
yield
Wisconsin.
1 minute to the distinguished lady from Wyoming, Ms. Lummis.
The gentlelady from Wyoming is recognized for 1 minute.
Thank you, Mr. Speaker. Let's review the top 10 reasons why Obamacare is wrong for women. Higher insurance costs, that's already happening. 20 new taxes, that's coming. The likely loss of your current insurance, we know that's coming. Losing dependent coverage, that's already happening. Employers losing rights of conscience over morally offensive procedures, already in litigation. The overwhelming of the Medicaid programs that are in states that participate in the extension. Loss of control over family health care decisions. Doctor shortages, a real concern in my state of Wyoming. And employers cutting back work hours for their employees to 25 hours a week to avoid the costly mandate. Loss of child-only health insurance policies, and now $210 billion added to the deficit over 10 years. Mr. Speaker, Congress passed a bad law. The President signed a bad law. The Supreme Court upheld a bad law. Let's repeal it. I yield back.
Gentlelady yields back. Gentleman from Maryland. Gentleman from
May I
Maryland is
inquire,
recognized.
Mr. Speaker, how much time is remaining?
3.5 minutes.
3.5 minutes. I yield myself the balance of the time.
Gentleman yields.
Mr. Speaker, during the debate over passage of the health care bill, Obamacare, we heard a campaign of massive distortions. We heard it was going to create death panels. Not true. We heard it was going to be a government takeover of health care. The independent PolitiFact called that the 2010 lie of the year. Now we hear it's going to wreak havoc on the economy when the head of the Congressional Budget Office, our nonpartisan referee, just said 2 weeks ago that they don't think this bill is having any significant impact on the economy. And on and on and on. We heard from our Republican colleagues they were going to repeal and replace. We've now repealed this 31 times in the House. No replacement. And what does that mean? That's the status quo. Our colleagues make it sound like the status quo was just great in the health care system, when the insurance companies got to run the show, when they got to deny kids coverage even if they had asthma or diabetes and pre-existing conditions, when they got to say you're not covered if you're 22 years old, you can't stay on your parents' health care bill, when premiums doubled between 2000 and 2006 while insurance company profits quadrupled. That's what the Republicans are proposing to go back to. We continue to hear this distortion about Medicare. The reality is that we reduced some of the big taxpayer subsidies to the private Medicare plans. Some of them were being subsidized 140% of fee-for-service. Average subsidy 114%. We used some of those savings to eliminate the prescription drug donut hole that seniors fell into, to eliminate many of the copays, preventive care services. Now, the Republican budget that every Republican in this House has voted for, that Mitt Romney has endorsed, they took all that $500 billion in savings, every penny. But you know what? They didn't plow one penny back into strengthening Medicare benefits. They would reopen the prescription drug donut hole. So that's what this debate is all about, trying to make sure that we provide the best health care we can at the best price. And to witness this effort to deny patients across this country the same kind of patient protections that members of this Congress have, I think is something that the American people, when they focus on this, as they clearly are, will clearly reject. What we should be doing, instead of taking away from millions of Americans the kind of patient protections that members of Congress have, what we should be doing is focusing on jobs and the economy. And it is a shame that as we're going to vote tomorrow for the 31st time to repeal Obamacare, we haven't had a single vote on the President's Jobs Initiative, an initiative that he brought before this body last September. He was at the podium where the presiding officer stands now. He asked Congress to pass his Jobs Initiative. Not a single vote on that. And yet here we are, our 31st vote to repeal the kind of patient protections that members of Congress enjoy, repeal them for the American people. So, Mr. Speaker, I hope that our colleagues will reject this effort. I know the American people have already made it clear through their voices and their response to surveys that they want to move on. They want to move on, they want to deal with jobs, and they want to deal with the economy, and they want to end the political charades. Thank you, Mr. Speaker.
Yields. The chairman from Wisconsin is recognized.
May I ask inquirers how much time remains?
4 minutes.
I yield myself the balance of the time.
Gentleman is recognized.
Mr. Speaker, here's why we're doing this. If the facts that we now know today about this law were available when this law was being debated, there's no way this would have become law. This is effectively a government takeover of 17% of our economy, the healthcare sector. It was sold on a number of promises by the President that are now broken promises. Taxes? There are 21 tax increases in this law, 12 of which hit people who are low and middle income earners. You remember the line, if you like the health care plan you have, you can keep it. Ha! Completely not true. What about the idea that this is going to lower health care premiums? They've been going up ever since the law passed. They're going up next year. They're going up even more. Here's the fear. What we worry is going to happen, what is happening, is you're going to have what we call BUCA. About 5 health insurers left. Blue Cross, United, Cigna, Aetna, and Anthem. That's the big joke in Washington. You'll have about 5 big, massive health insurers who are de facto public, providing government extension companies like your utility company, except they're going to be controlling your health care. People say we should focus on jobs instead of this bill. This is about jobs. The CBO is telling us it could cost us 800,000 jobs. I remember talking to an employer in southern Wisconsin not too long ago. Family business, a big family business, a private business. The woman who runs this business, whose grandfather founded it, had tears coming down her face because she provides health insurance for her employees at about $17,000 a year for a family plan. She's proud to do it. Her competitors notified her at one of her trade association meetings, they're publicly traded, that they are going to have to dump everybody in Obamacare and just pay the $2,000 per person fine. $15,000 difference per person between herself and her competitors. She was telling me that she felt she had no choice, but when the time came to dump her people into Obamacare. That's what's going to happen in this country. People will get dumped into Obamacare. Obamacare will underpay providers. Providers will go out of business, they'll overcharge the private sector, and we'll get a vicious cycle. Here is the awful irony about this. We can have affordable access to health insurance for everybody in America, including people with pre-existing conditions, without this government takeover. That's why we do believe in replace. That's why we had advocated then, and we continue to advocate today, for patient-centered health care reforms. Deal with the discriminatory tax treatment on health care. Get transparency on price, quality, and outcomes so people can really shop. Have pooling mechanisms so people can bulk buy health insurance. Help those with pre-existing conditions. Save Medicare and Medicaid by harnessing the power of choice and competition. Have the providers compete against each other for our business as patients, instead of hoping that the whims of some government bureaucrat will favor us when they make their next price-controlling and rationing decision. We can do better than this. Here's ultimately why we're doing this, Mr. Speaker. A few weeks ago, we had 2 chances to repeal and therefore replace this law. Now, we have 1. The Supreme Court upheld this law. That doesn't make it good policy. The 1 chance left, and yes, this is the 31st time, and I fear we're going to have to do it the 32nd time, because the 1 chance left is that the American people, through their elected representatives, through a House of Representatives, a Senate, and a President, has 1 more chance before this law is fully implemented in 2014 to repeal this law and replace it with true patient-centered health care reform, and that is why we're doing this today. With that, I yield back the balance of my time.
Chairman yields back. With regards to remarks of a previous speaker in the debate, the Chair would remind members that it is not in order to suggest dishonesty on the part of the President, such as stating that he was not being straight with us. The gentleman from Texas is recognized for 15 minutes.
Mr. Speaker, I yield myself such time as I may consume.
Gentleman is recognized.
Mr. Speaker, I support this legislation to repeal the new health care law, which will shrink jobs, increase taxes, and limit Americans' freedoms. Although the Supreme Court has delivered its decision on Obamacare, it is the people whose verdict counts the most. And the American people have consistently rejected this costly and ineffective government takeover of the health care sector. They realize that the law fails our families, drives up the cost of health care, undermines the doctor-patient relationship, tramples on the religious liberty of millions of Americans, and vastly expands the role of the federal government. And after the Supreme Court decision, we now know that Obamacare is a massive tax hike on the middle class. While the Supreme Court may have declared the law constitutional, that does not mean it is good policy for the American people. Obamacare forces millions of Americans to abandon their current health care plans and give up the physician of their choice. A recent Reuters poll found that 56% of respondents oppose Obamacare and 61% oppose the individual mandate. With the cost and massive middle-class tax increase this law imposes, these poll numbers, frankly, are not a surprise. This massive tax hike on the middle class must be repealed. Only when Obamacare is fully repealed can we enact real reforms that reduce health care costs without restricting the rights of Americans. One reform Congress should consider to lower cost is medical liability reform. Medical liability reform will reduce the cost of health care by decreasing the waste in our system caused by defensive medicine. This practice occurs when doctors are forced by the threat of lawsuits to conduct tests and prescribe drugs that are not medically required. According to a Harvard University study, 40% of the medical malpractice lawsuits filed in the United States lack evidence of medical error or any actual patient injury. Many of these suits amount to legalized extortion of doctors and hospitals. The Congressional Budget Office estimates that lawsuit abuse reform would save taxpayers $48 billion over the next 10 years. The American people do not want Obamacare. As their representatives, we must repeal Obamacare and enact real health care reforms that lower costs, increase access to health care, and preserve the fundamental freedoms of all Americans. Mr. Speaker, I'll reserve the balance of my time.
Michigan is recognized for 15 minutes.
Mr. Speaker, I yield myself as much time as I may consume.
Gentleman is recognized.
This has been an unusual debate in Congress over an extremely important matter. What we have witnessed and listened to today for the 31st time is something that I would like to spare our conservative friends the heavy responsibility of trying to go back to their districts to explain why they voted to allow insurance companies to deny coverage for 17 million children with pre-existing conditions. I would like them not to have to explain why they voted to kick over 6.5 million youngsters up to age of 26 off their families' insurance policies. I do not want my dear friends on the other side of the aisle to explain why their community hospitals will again have to provide free care to people without insurance to pay for the medical costs of the uninsured. Medical providers, of course, pass these costs on to private insurers, which pass them on to families, increasing premiums on average about $1,000. You can tell families paying this hidden tax why they want to impose it. I don't want them to have to try to explain that. I don't want my conservative friends in this body to explain to the 13 million Americans who won't receive $1.1 billion in rebates this summer from health insurance companies that have overcharged them. And so it goes on and on. We don't want anyone here to have to explain to the 105 million Americans who will have to face a lifetime limit on their coverage why they would want to allow insurance companies to deny them coverage once they got sick. And then, of course, there's the pre-existing conditions that are an excuse to, first of all, not insure for health insurance, but in addition to deny insurance once they have it, if they feel that it is a long-term illness. We don't want any of our conservative friends to leave the House to have to go home to explain to the 360,000 small business employers who use small business health care tax credit to help them afford health insurance for 2 million workers that they will not get it any longer. And finally, this bill they will not have to explain why this bill promotes the fiction that repealing the Affordable Health Care Act won't increase the deficit. We can't keep doing this. I hope nobody's thinking about 32 or 33 times. There has been no comparable debate over a major legislation that has been through this kind of tortured process in recent memory. Mr. Speaker, I reserve the balance of my time.
Gentleman reserves. Gentleman from Texas is recognized.
Mr. Speaker, I yield 4 minutes to the gentleman from California, Mr. Lundgren, who is a distinguished and senior member of the Judiciary Committee.
Gentleman from California is recognized for 4 minutes.
I thank the chairman for yielding. And Mr. Speaker, the chairman of the Budget Committee, Mr. Ryan, has outlined in very much detail how the current law, some call Obamacare, some call it the Patient Protection Affordable Care Act of 2010, does not do what it claims to. It, in fact, does not protect the patient, and it does not provide affordable care. He also pointed out that when this bill was argued on this floor and in the other body, it was denied time and time again that it was a tax. We recall the President of the United States on several public occasions denied it was a tax. And yet, he had his administration argue before the U.S. Supreme Court on the question of constitutionality that it was a tax. The American people view the federal government as an entity. And what have they seen with respect to this as it went from the executive branch to the legislative branch to the judiciary? They find that they were played. They find that what they were told at one point was not that which it was at the other point. If you look at the Supreme Court's decision, they had to first consider whether this was a tax under what's known as the Anti-Injunction Act. The Anti-Injunction Act essentially says you can't contest a tax until it has been visited upon you. And the question was, since the individual mandate, conceived as a tax, doesn't come into effect for some time, how could it be before the court? So the court said, for purposes of standing, it is not a tax. And then they went and analyzed the individual mandate and said, is it constitutional under the Commerce Clause? No. Is it constitutional under the Necessary and Proper Clause or the Spending Clause? No. But then they said, we will interpret this mandate, this penalty, as a tax for purposes of constitutionality, as argued by the administration which had denied it when it was arguing that case here in the House of Representatives in the United States Senate. Is it any wonder people are cynical about this? Is it any wonder that people begin to lose their confidence in a government that will not present facts consistently to them? I will not say there were any intentional lies made, but I will say that the American people have to question, do they have confidence in their government when they say one thing at one time and say another thing at another? In fact, now, by virtue of the Supreme Court decision, this is the largest single tax on the middle class of America in history. That's what we're talking about. Can we do better? We believe we can. We believe that you can provide affordable health care for the American people without the largest single middle-class tax in the history of the nation, which puts the federal government in the position of being between the patient and the doctor. It is the antithesis of patient family-centered health care. That's why we're here. Not because we believe the present system is perfect. We think it is broken. The status quo is not acceptable. But we believe that this bill, Obamacare, that is before this Congress right now, is unacceptable to the American people because it exacerbates the problems that we find in our health care delivery system. That's why we're here. The fact of the matter that we have voted several times to repeal it and have yet to be successful is no reason for us to give up.
Expired.
We are standing here for the American people against the largest middle-class tax increase in the history of the United States, and we will not stop until we are ultimately successful.
Gentleman yields back.
Mr. Speaker, I yield myself 15 seconds to assure my dear friend from California, a former Attorney General of his state, that the Supreme Court has made more decisions that I don't like than he doesn't like, and the Chief Justice of the Supreme Court, rather than get into the Commerce Clause, ruled it a tax. I'm sorry he did that. I wish he had done it my way, and you don't like the way that he did it. I yield now to the gentleman from New York, the former chairman of the Constitutional Subcommittee, the House Judiciary Committee, Jerry Nadler. 3 minutes.
The gentleman from New York is recognized for 3 minutes.
I thank the gentleman for yielding. Mr. Speaker, I rise in strong opposition to the Republicans' 31st attempt to repeal the Affordable Care Act. Mr. Speaker, you don't have to be a policy wonk to know that the U.S. economy is still struggling to rebound. Millions of Americans are still unemployed or underemployed. That this Congress has not spent every single day of the last year and a half fighting to put people back to work is unconscionable. And now, instead of fighting for good-paying American jobs, Republicans are launching their 31st attempt to repeal the Affordable Care Act. First, the Republicans said the law was unconstitutional. The Supreme Court said they were wrong. Next, Republicans said the law was too expensive. The Congressional Budget Office said they were wrong. Now Republicans say the law will raise taxes on millions of middle-class families. The Urban Institute says they are wrong, estimating that a mere 3% of Americans under 65 will face the choice between purchasing insurance and paying a penalty. Mr. Speaker, let's review what the Affordable Care Act actually does. We know it extends health insurance to 32 million uninsured Americans, which will prevent the unnecessary deaths of 45,000 people who die each year because they lack health insurance. We know it will enable millions of Americans with pre-existing medical conditions to get insurance. This has gotten publicity. But also, every middle-class family today is one cancer diagnosis away from bankruptcy. 55% of all personal bankruptcies are caused by health insurance, by health care emergencies. And 75% of these bankruptcies are of people who had health insurance, but health insurance that proved inadequate to cover an expensive disease like cancer. But by preventing insurance companies from denying coverage for pre-existing conditions, and by eliminating the annual and lifetime caps on coverage found in most current policies, the Affordable Care Act will guarantee that middle-class families will no longer have to fear going broke because of an expensive illness. Despite all the benefits of this law, Republicans have decided the whole law must go. Fine. They want to repeal and replace. Well, replace it with what? What is the Republican plan to stem the ever-rising cost of health care in this country and to reduce out-of-pocket health costs? What is the Republican plan to help millions more Americans gain access to health insurance? What is the Republican plan to end discrimination in the insurance market for women, for those with pre-existing conditions, for those who are sick and are going broke because of medical bills, for those who die because of lack of care? There is none. The simple truth is that the Republicans have no plan. Mr. Speaker, I urge my Republican colleagues to do something new, to try something novel. Instead of going to their familiar well of election year politics in a steady stream of no, let's try to work together. Let's not turn a blind eye on the problem and hope it goes away. Let's not be indifferent to 45,000 unnecessary deaths of Americans every single year. I urge my colleagues to vote no on this repeal bill so that we can move on to fighting for American jobs and we can move on to ensuring the middle class that they won't go broke because of an expensive illness, and to ensuring 30 million Americans that they can get health insurance when they need it. I yield back the balance of my time.
Gentleman from New York yields back. The gentleman from Texas is recognized.
Mr. Speaker, I yield 3 minutes to the gentleman from Iowa, Mr. King, a respected member of the Judiciary Committee.
Gentleman from Iowa is recognized for 3 minutes.
Thank you, Mr. Speaker. I thank the esteemed chair of the Judiciary Committee for yielding time to me, and I appreciate bringing this issue to the floor. I would announce, Mr. Speaker, that this is a subject matter, the full 100% repeal of Obamacare, that I have worked on now for over 2 years on the repeal. When we saw this pass, it passed the House for the first time on November 7th, 2009. And that was a long and difficult day here in this House of Representatives, and it came back through for a final passage by legislative shenanigan, by packaging up the reconciliation along with an earlier piece that went through over the requiring the 60-vote filibuster-proof majority that took place for a time in the Senate, and came to this House under unprecedented terms, Mr. Speaker. And we saw the American people rise up. They didn't just jam this Capitol. It wasn't just 10,000 plus or tens of thousands of people that came here to say, keep your hands off of our individual American freedom and liberty and health care. It was tens of thousands of people that came here that said, let's respect the Constitution, let's respect fiscal responsibility, let's respect individual rights, and let's respect the American people. Well, through that period of time, over this last 2+ years, and a night I couldn't sleep after this finally passed on about March 21st or so, 2+ years ago, I got up and wrote a repeal. And that language for that is in this bill, most of it intact. I'm glad we're at this point, Mr. Speaker, because it says that this House of Representatives has reflected the will of the American people. They reflected the will of the American people in the elections a year ago last November, when we saw 87 new freshman Republicans come here to this House of Representatives, and every single one of them ran on the full 100% repeal of Obamacare. Every single one of them voted for the full 100% repeal of Obamacare, and every single Republican senator, 47 of them, voted for the full 100% repeal of Obamacare. And, Mr. Speaker, the next step is this next November, when I believe there will be a change-out in the United States Senate that reflects what happened here in the House, so that the full will of the American people can be worked in this body that's to be responsive to the American people. And while that's gone on, this terminology that began the Patient Protection and Affordable Care Act, always understood to be Obamacare, referred to himself as Obamacare by President Obama on February 25th in the Blair House in the health care discussion that took place when the President interrupted Republicans 72 times. Not that that's an issue, Mr. Speaker, but just for the record. He referred to it as Obamacare. Many of the Democrats have believed that it's pejorative. So they changed the name of it because nobody knew what the Patient Protection and Affordable Care Act was. They changed it to the Affordable Care Act. Well, we know it is the Unaffordable Care Act. It's a couple of $1 trillion stacked on this heavy burden the American taxpayers have today of nearly $16 trillion altogether. It's the Unaffordable Care Act, and in fact what it does is it reduces care. And it reduces American freedom and liberty. And when you think about the American people, how distinct and unique it is to be an American. What makes us different? We come from a lot of places on the planet. We have the vigor of the American people here, and it's totally unsuitable to be saddled by this unconstitutional takings of American liberty. And I thank the Speaker, and I yield back.
Gentleman yields back. The gentleman from Michigan is recognized.
Mr. Speaker, I'm pleased now to recognize a senior member of the Judiciary Committee from Texas, the Honorable Sheila Jackson Lee, and we yield her 2 minutes.
Gentlewoman from Texas is recognized for 2 minutes.
I am glad. I thank the gentleman from Michigan, and I thank this House, reminded of the Declaration of Independence that calls upon this great nation to pursue life and liberty with certain inalienable rights. As I paraphrase it, I don't know what the answer is to my friends on the other side. I don't know what the answer is to those who are languishing in the state of Texas when we have our governor rejecting Medicaid and politicizing it by, in fact, in the Obamacare plan, the federal government sought to force the states to expand Medicaid. He says in repeating that the gun to our head has been removed. certainly a personal statement by this governor. I asked him whether or not he has asked 357,000 young people in the state of Texas who actually are on insurance plans because of this bill. I wonder, has he asked the 3 million children that have benefited in the state of Texas since 2010? Boys and girls like these little ones who are seeing doctors now for the first time. What next is the question. Maybe this little one who needs to have doctor's appointments. I'd like to know, has he responded to the fact that our plan, the Affordable Care Act, reduces the deficit by $143 billion? Has he responded to the fact that 5.3 million seniors have saved $3.7 billion in Part D? Or does he realize that health care costs has been halved to 3.9% now after this legislation was passed, the Affordable Care Act? Because before it was 6% and over. I call Obamacare Leroy Care, Maria Care, Senior Citizen Sick Care, Nursing Home Care. That's what it is. Does he realize that the American Cancer Society said this organization was looking at the ruling on Medicaid and are concerned that the decision may limit the expansion of quality coverage to some of our nation's most vulnerable citizens? That is what the governor of the state of Texas has done, and many others. And finally, Mr. Speaker, these soldiers who are coming home who lose TRICARE are the very people in the state of Texas. Do you have 15 seconds? 30 seconds.
Recognized for 15 seconds.
Very people in the state of Texas of who we want to salute and honor. They will come home. Their families will need the Affordable Care Act. 30% in the 18th Congressional District in Houston. We will lose this. $1.74 trillion in costs in health disparities.
Gentleman's time has expired.
Death and disease because we are losing the Affordable Care Act. What is next?
Speaker,
what is your answer?
Chairman,
I yield back.
Mr. Speaker, I yield 1.5 minutes to the gentlewoman from Florida, Ms. Adams, a distinguished member of the Judiciary Committee.
1.5 minutes.
Thank you, Mr. Chairman. Mr. Speaker, I rise today in support of H.R. 6079, repeal the Obamacare Act. Along with many Americans, I was disappointed that the Supreme Court did not strike down the law, but the court did rule that Obamacare is a tax on all hardworking taxpayers, including middle-income taxpayers. Let's go back for a moment to when this bill was passed. In 2010, President Obama said, if you like what you have, you can keep it. We now know that isn't true. He also said health care costs would go down. And again, not true, because health care costs are rising. They've gone up. He also said numerous occasions that this is not a tax. It's a penalty. Well, the Supreme Court has spoken, and there is no denying now that it is a tax on all hardworking taxpayers. We all remember former Speaker of the House Nancy Pelosi's famously saying, we have to pass a bill so that you can find out what is in it. The 111th Congress passed the bill, ignoring the will of the American people. And after the bill was signed into law, Americans across this great nation did find out what was in the bill, and guess what? They didn't like it. Across the country, Americans showed their displeasure with Congress at the ballot box. With their votes, they demanded Congress listen to them and repeal Obamacare. Even today, Obamacare is less popular than it was the day my Democrat colleagues passed it. It's not hard to figure out why the American people don't like Obamacare. This is a law that takes $500 billion from Medicare, a law that will lead to the rationing of care of our seniors, and a law that adds job-killing taxes on individuals and small businesses when our economy is hurting.
The gentleman from Michigan is recognized.
Mr. Speaker,
Speaker, I'll yield the gentlewoman from Florida an additional 15 seconds.
I'm sorry, the gentlewoman from is recognized for 15 seconds.
Furthermore, the individual mandate is the largest tax increase in American history. Largest tax increase. So it is time, my colleagues on the other side of the aisle join us to repeal Obamacare and its taxes. I may not have been here when Congress passed Obamacare, but I was sent to Washington by my constituents to repeal it.
Time has expired. Gentleman from Michigan is recognized.
Mr. Speaker, I yield myself 15 seconds to remind my distinguished friend from Florida on Judiciary Committee that Obamacare extends Medicaid and does not cause anybody to lose any insurance if they already have it. And I now turn to the distinguished gentlelady from Los Angeles, California, who has worked with us on so many progressive causes. I yield Maxine Waters of Los Angeles 2 minutes.
The gentlelady from California is recognized for 2 minutes.
Thank you very much. I thank the gentleman from Michigan for the time. I rise to oppose H.R. 6079, the Republicans' 31st attempt to repeal the Affordable Care Act. This bill is ridiculous. It is as ridiculous as the previous 30 votes to repeal health care reform. It is ridiculous because this bill is going nowhere. It will not be taken up by the Senate, and even if it were to pass the Senate, the President would veto it. Every day, people die from preventable and treatable diseases. Every day, almost 50 people die of HIV/AIDS. More than 1,600 people die of heart disease, and more than 5,000 people are newly diagnosed with diabetes. Yet the Republicans are trying for the 31st time to deny Americans access to preventable health services and treatment for these conditions. Because of the Affordable Care Act, more than 6 million young adults under the age of 26 now have health insurance through their parents' plans. Many of these young people just graduated from college. They were worried about finding jobs and paying off their student loans. Yet the Republicans are trying for the 31st time to take away their right to health insurance coverage. Because of the Affordable Care Act, up to 17 million children with pre-existing conditions can no longer be denied coverage by their insurers. Yet Republicans are trying for the 31st time to return to the days when these children could not get health insurance. The bill on the floor today is a political charade. It is not going anywhere, and it is wasting our time when we should be focusing on jobs in our economy. I urge the Republicans to stop this charade, withdraw this bill, and move on to the pressing issues facing this country. As a matter of fact, Republicans forever talking about saving the taxpayers' money. You're wasting the taxpayers' money. Look at the energy costs. Look at all the man hours and the personnel time that's being spent on this floor. Look at all these young people who should be at home with their families. Look at the cost that you're incurring with this charade. Stop it. It is ridiculous. It's not going anywhere. Mr. Lundgren said you had made a few attempts. No, let me remind you again, 31 attempts. It is ridiculous. It is outrageous. It's a charade, and you should stop it. And I yield back the balance of my time. I don't even know why I came here.
The gentlewoman yields back. Chairman from Texas is recognized.
Mr. Speaker, I yield 1 minute to the gentleman from Texas, Mr. Gohmert, who is a distinguished jurist before he became a member of Congress and then a distinguished member of the Judiciary Committee.
Gentleman from Texas is recognized for 1 minute.
Thank you, Mr. Speaker. I can verify that there are people who have already lost their insurance because of Obamacare. It has happened. It is not true that if you like your insurance, you could keep it. People have already lost doctors who were assured if you like your doctor, you keep it. That was simply not true. We were told there would be no tax, and we know from the Supreme Court that's not true. And in fact, in the bill itself, one of the most devastating things coming from people who say they want to help the working poor, if you're a single individual and you're making 133% of the poverty level, if you're making $14,000 and you can't afford a $12,000 health insurance policy, you're going to be fined 2.5%. Over the next 3 years, it'll build to 2.5%. It is a tax. It will devastate. If you make $40,000, a family of 4 or 5 or 6, $1,000 fine because you can't afford a $12,000 policy. That, on top of the government running everything in this $2,500 bill, that's why we've got to repeal it for the good of the people.
Mr. Speaker, I yield myself 15 seconds.
Gentleman from Michigan is recognized.
To tell Judge Gohmert that there isn't one American in this country that has lost their insurance because of Obamacare. Not one. And now I turn to the gentleman from Tennessee, distinguished member of the Judiciary Committee, Mr. Cohen. I yield him 2 minutes.
Gentleman from Tennessee is recognized for 2 minutes.
Thank you, sir. I appreciate the time. I was a history major in college, and oftentimes I'm in this hall and I think about the history. We've been in this hall for nearly 150 years. And I think back, and I think that when there was an attempt to pass Social Security, the Republicans were against it. And they're still against it. They want to give it to Wall Street and let it be invested. And then the great next major historical social advance in our country's history was Medicare. And the Republicans were against it. And now they're against the Affordable Care Act and the Patient Protection Act. It seems what's happened, every Republican voted against it, and every Republican lines up saying Obamacare and talking about Speaker Pelosi, and they're lined up pretty well like ducks at the Peabody Hotel going in a line into the fountain. And the Democrats, on the other hand, are concerned about children and women and life and the deficit in the long run because of health care. And it seems like there's a continual battle in this House between people who look out for the haves and the other group that looks out for the haves who have conscience or vision, and the have-nots. And I was taught well by my parents, I believe, and that it was always to look out for people who needed something, who knew you could help. Daniel Webster's words are inscribed in this Capitol, right in this hall, about doing something worthy to be remembered. That's what we're here for. The Affordable Care Act and Patient Protection Act is something worthy to be remembered, to care for and help people survive. It's provided, and next month it's going to provide $1.1 billion for over 12 million people who've been overcharged by their insurance companies. President Obama said this was insurance reform on steroids. It is. You want the insurance companies to run your life? Well, for you 12.5 million people, they're going to get $1.1 billion back. This is just the beginning of something great when you have some controls over the insurance company.
Gentleman's time
I
has
yield
expired.
back the balance of my time, and I'm appreciative of doing something worthy to be remembered.
Gentleman yields back. The gentleman from Texas is recognized.
Mr. Speaker, we're prepared to close on this side, so I'll reserve the balance of my time.
Gentleman from Texas reserves.